Here's the latest legislative news from the Texas Hospital Association, May 22, 2023. 1 week from today, the slog will be over. The Texas Legislature's 2023 session will gavel out, and THA will know exactly where hospitals stand after nearly 5 months of lobbying, maneuvering, and interminable days and nights. But first, plenty of work still remains. Last week, for the first time this session, THA witnessed a piece of its efforts reach its ultimate destination, as one of its top-line initiatives finally earned the governor's signature. On Thursday, Governor Greg Abbott signed Senate Bill 240 by Senator Donna Campbell and House co-sponsor Representative Donna Howard to tackle workplace violence at hospitals across Texas. Senate Bill 240 requires all healthcare facilities to implement a workplace violence prevention policy, maintain a workplace violence committee, and provide workplace violence training at least annually. The bill also prohibits retaliation or discipline for reporting a violent incident in good faith. It will take effect on September 1st. THA will summarize Senate Bill 240 and other bills that become law in its post-session Health Law Manual. The governor received other THA-supported pieces of legislation to consider last week, with House Bills 1890 and 3162 both reaching his desk. House Bill 1890 by Representative J.C. Jatan, which would allow Texas hospitals to continue participation in the federal Hospital-at-Home program, passed the Senate on Monday. THA has been a staunch supporter of Hospital-at-Home following its success at helping facilities manage bed capacity during COVID-19. The Senate on Thursday then approved House Bill 3162, which would reform the Texas Advanced Directives Act's dispute resolution process and its law on in-hospital do not resuscitate orders. THA, which worked on the bill with the Texas Medical Association, Texas Alliance for Life, Texas Right to Life, and other stakeholders for more than 40 hours of face-to-face negotiations, submitted written testimony on the bill Tuesday in the Senate Health and Human Services Committee. THA's testimony complemented the bill's improved processes for patients, which include increasing the number of days of notice prior to a hospital ethics committee meeting, clarification on patient or surrogate representation at those meetings, and the providing of additional information to patients and their representatives. More good news came with the advancement of Representative Tony Rose's bill to extend postpartum Medicaid coverage for mothers to 1 year. House Bill 12 had been stuck without movement in the Senate Health and Human Services Committee for about 2 weeks before finally receiving a hearing Tuesday, where THA submitted written testimony in support. Then on Thursday, the committee voted the bill out, 7-0. The 10-member Budget Conference Committee finished its work last week to reconcile the differences between the House and Senate versions of the 2024-25 budget, with substantial good news for hospitals mixed in with some disappointment. If you're a bad news first type, budget conferees did not adopt one of THA's identified needs to solidify behavioral health care, a state waiver from the federal Institutions of Mental Disease, or IMD exclusion, which caps Medicaid coverage for inpatient behavioral health stays at 15 days for patients ages 21 through 64. A budget rider for the IMD exclusion was previously included in the House's version of the budget, but not the Senate's, and did not make the final budget bill. However, behavioral health funding elsewhere in the conferee's final product provides a boost for hospitals. The committee added funding for nearly 200 additional state-purchased inpatient psychiatric beds, increased funding for community behavioral health grant programs, and also allocated funds for rural hospital telepsychiatry consultations. Conferees also tripled Medicaid rural and delivery add-on payments, taking them from $500 to $1,500, allocated $51 million for a new grant program to stabilize rural hospitals, and fully funded EMS and trauma care payments. Women's preventive health programs also received a funding increase, as did the Texas Department of State Health Services Maternal Health Unit. The conference committee's agreed-upon budget must still be approved by both chambers and signed by the governor before session ends. A measure that requires hospitals to submit an itemized bill with every payment request made to a patient, opposed by THA, went to the governor's desk last week. THA's objections to Senate Bill 490 by Senator Brian Hughes were grounded in the administrative burden and expense the requirement would introduce for hospitals of all sizes and stripes, as well as patient confusion upon receiving paperwork they didn't ask for. However, before its finalization in the Senate last week, Senator Hughes emphasized that Senate Bill 490 only applies to third-party debt collections. A motion by Senator Charles Schwertner to have those remarks printed in the Senate Journal was accepted, which THA hopes will stave off any confusion or attempted overreach tied to the bill if the governor signs it into law. That's all for this week. Look for the final cap recap of the 2023 regular session next week, shortly after the legislature's May 29th adjournment.